Hello, my name is Fabio del Piero. I'm faculty at University of Pennsylvania, New Bolton Center, and today I'm going to present you Pathology of the Foal. It's a collection of gross lesions with some basic histopathology and immunohistochemistry. So I hope a pretty complete review on pathology of foals. We start with the leucon. Thymus necrosis, equine herpes virus 1 and equine herpes virus 4 are viruses that induce prominent economic losses to the equine industry. In particular, equine herpes virus 1 is able to induce sporadic and episodic abortion in horses. And one of the target tissues of this virus is the lymphoid tissue, and in particular the thymus, spleen, and lymph nodes. And in newborn foals and in fetuses is possible sometimes to observe grossly a severe necrosis, like in this case. And histologically, it's possible to appreciate mild to severe necrosis, which is generally multifocal, and with indirect immunohistochemistry is almost always possible to detect some quantities of EHV1 antigen in the tissue. In this case, in the thymus, it's possible to observe that several cells are express the antigen of this virus, and target cells are the stromal epithelial cells of the thymus, lymphocytes, endothelial cells, and macrophages. The thymus is a very important organ to collect in the newborn foal and the equine fetus to collect this type of infection, where histopathology, immunohistochemistry, and conventional virology and molecular diagnosis could be performed. This is a normal spleen from a foal, and as you can appreciate, lymphoid follicles are very prominent, and this is normal for a newborn foal. Would be also normal for a fetus at term. In case of necrosis or edema due to, for instance, viral infections like equine herpes virus 1 or equine arteritis virus, lymphoid follicles could appear grossly more pronounced due to necrosis and edema. If follicles are not present at birth, it means that the foal is affected by severe combined immunodeficiency, which now is a rare disease, which in the past was observed in several breeds, but especially in Arab foals, where lymphoid organs are severely depleted, atrophied, with no gross evidence of lymphoid follicles. This is a normal image of this normal architecture of the thymus of a foal with very prominent lobules. And this is the thymus of a foal with severe combined immunodeficiency. Largely the tissue is replaced by adipose tissue, and the lymphoid population is dramatically reduced. These foals don't survive for a long time since their immune system is so compromised because of the severe lymphoid organ depletion atrophy. Generally they are exposed to secondary infections, and the most common is a systemic infection with equine adenovirus. Equine adenovirus is not pathogenic in normal foals and in adults, but in these skid foals it can induce severe necrotizing bronchiolitis with severe respiratory stress and death. Histologically, in these falls, it's possible to observe necrosis of the lining epithelial cells of bronchioli and the pathognomonic intranuclear amphophilic viral inclusion, also associated with the classic margination of the chromatin. These are Cowdrey viral inclusion of the B type. Lymph nodes affected by suppurative lymphadenitis due to Streptococcus equi. This bacterium can induce severe peripharyngeal, retropharyngeal lymphadenitis. It can also induce systemic lymphadenitis. The lesion is very characteristic. Lymph nodes are severely enlarged and with variable quantity of pus present within the organ and particularly evident on the cut surface. In some cases, the pus can be present in very small quantities, and the organs can be largely replaced by fibrous tissue with some multiple abscesses. Sometimes bacteria can localize not necessarily in the retropharyngeal area, but also in other lymph nodes, like in this case in the mesenteric lymph nodes. Again, it is a case of severe chronic suppurative lymphadenitis due to Streptococcus equi. Occasionally, also other streptococci can induce the same lesion. But definitely the most contagious unnotifiable disease in several areas is Streptococcus equi. Other cocci able to induce similar lesions, but sporadically, are Streptococcus equi zooepidemicus and Streptococcus equisimilis. Occasionally, Streptococcus pneumoniae has been also isolated from foals and adult horses. The pus of Streptococcus is generally whitish, slightly yellowish, and the exudate of other lesions caused by other bacteria can vary. So if Streptococcus induces this kind of whitish aspect of the pus, other bacteria like Rhodococcus equi are characterized by a different color and different consistency of the pus. For instance, in this case, Rhodococcus equi inducing a necrotizing case of lymphadenitis, the mesenteric lymph node, is characterized by a rather yellowish, more dryish, caseous exudate. As you can see from the leg here on the left, the lymph node is extremely enlarged, and Rhodococcus equi is commonly present to the soil, is a very common etiologic agent in horses, is able to induce pneumonia, lymphadenitis, enterotic colitis, polyarthritis, abscesses in various parts of the bodies, osteomyelitis, even dermatitis. Is a bacterium structurally rather similar to Mycobacteria, and like Mycobacteria induces a caseous exudate, the formation of caseous lymphadenitis, caseous lesions. Another example of lymphadenitis, in this case on the large intestine, the colon, due to Rhodococcus equi. In case of euthanasia, using a barbiturate solution, it's possible to observe in the majority of cases a dramatic increase in volume of the spleen due to the hyperemia induced by the barbiturate injection. Differential diagnosis of this large spleen are in adults lymphoma, not in foals, very rarely, Other possible neoplastic disease which are not described in foals, only in adults, and systemic passage congestion. Also, in foals and in adults, it's possible to observe small incisions or folding on the splenic capsule, like in this case, close to this label, red label. These are congenital folds without any particular pathologic significance. Often in newborn foals, or foals that got a few days of age, we observed mild to severe depletion of the splenic lymph node, lymphoid follicles, and sometimes also depletion of the thymus. This can be due to infections, especially bacterial infections. In case of sepsis, we observe these changes pretty frequently. And if there is also necrosis, sometimes with karyopexis, generally these changes are caused by viral infections like very frequently equine herpes virus 1 and 4, abortion and stillbirth, or sporadically equine viral enteritis, which is another agent that can induce cytolysis of the lymphoid tissue. Intestinal system. There are a few congenital abnormalities affecting the upper tract and of the intestinal system, and then the also more distal tract. This is an example of brachydactyly, also called parrot mouth, not compatible with life because generally owners decide to cull these individuals. Occasionally it's possible to observe also other changes like palatoschisis, cleft palate, or other segmental hypogenesis or agenesis involving the oral cavity. In this case, there is also this deposition of grayish material on the skin. It is called vernix caseosa. Literally from the Latin, it means cheesy painting because of this kind of caseous appearance. And this is a deposition of amniotic material coming from the skin of the foal itself, which can be observed in some newborn foals and in some aborted fetuses. The oral mucosa can be affected by various types of hemorrhages, in this case multiple petechiae and hyperemia, and often this is associated with the hypoxia caused by the stillbirth associated to equine herpes virus 1 or equine herpes virus 4. In these animals, the virus induces an endometrial necrosis followed by sudden placental detachment, and these animals died for a combination of hypoxia and a progressive invasion of the virus of the parenchymal organs. And this hypoxia apparently induced this kind of endothelial damage and hyperemia in various parts of the organs, and it's particularly evident in the oral vestibulum with this petechia. Tongue, parakeratotic hyperkeratosis due to Candida. Generally, these foals are heavily treated with antimicrobials. For instance, a classic is foals with enteric salmonellosis that probably because of the immunosuppression due to salmonella, which is prominent leukopenic agent, and the antimicrobial treatment, these animals develop a secondary candidiasis. Another example in the esophagus of parakeratosis associated with Candida pseudohyphae. And in this microphotograph, in this PAS stain borrowed by the FIP collection, it's possible to observe Candida pseudohyphae and fructiferous bodies. Sometimes it's not easy histologically to find the yeast. You need to cut several sections to find a good example of pseudohyphae and fructiferous bodies. And always the use of histochemistry like PAS or silver stain is highly suggested. Sporadically, we observe Emangio Sarcomas in newborn foals. This is a case of a tumor that develops in utero or in life, in this case in utero during the late phase of pregnancy. The tumor is particularly involving the oral cavity, in particular the gums, like you can see in this image, severely ulcerated, and also was present in other parts of the body, especially skin. But it is a very invasive neoplasm, and although it doesn't progress in the horse with the same speed that can progress in dogs or generally small animals, is very insidious and can colonize oral cavity, joints, skin, parenchymal organs. In this case, again, a congenital hemangiosarcoma in a foal. Histologically, the diagnosis is not too difficult because it's possible to observe in the areas which are not necrotic, and it's possible to observe multiple cavity lined by clearly abnormal endothelial cells, very basophilic, forming some irregular vascular cavities, sometimes with intraluminal erythrocytes, and sometimes some solid cords of neoplastic endothelial cells. Sometimes the tumor is severely necrotic or characterized by a very prominent stroma, so it may be difficult in some areas to make a diagnosis of hemangiosarcoma. So multiple sections are the best way to reach a diagnosis. The stomach in foals can be affected by ulcers. This is a very common condition in foals. Factors can be stress, loss of appetite, some drugs, and ulcers are both common in both foals and adults. The ulcer in the adults rarely lead to gastric perforation. Ulcers in foals more frequently lead to gastric perforation. On the other hand, the gastric rupture is very common in the adult horse and is very rare in the foal. In this case, both the squamous portion of the stomach and also partially the secretory, the portion of the stomach, are severely affected by chronic ulceration. And also in this case, on the left, the duodenum is severely affected by diffuse chronic ulceration. In this beautiful image of Professor John King of Cornell University, it's possible to see the same phenomenon that we just observed in the previous slide. And in this case, both gastric and squamous portion are severely affected. The margo plicatus is characterized by a very deep lineal ulcer, and also the duodenum is severely affected with very deep ulcer with perforation. In this case, the patient will die of septic peritonitis. In the first phase of the perforation, the omentum tend to contain the digesta pouring within the abdominal cavity, but after a few hours, septic peritonitis develops. If the animals survive, and we see this condition sporadically but constantly, if the animals survive the duodenal ulceration, unfortunately, often a stenosis occurs with deep scarring, formation of abundant fibrous tissue, and secondary lesion for these strictures are additional gastric ulcers because the reflux of the peristalsis in this area, the passage of the digestive is severely compromised. But in addition to gastric ulcer, it's possible to observe also an ascending ulcerative esophagitis, also an ascending pancreatitis, like you can see here on the right side, with dilatation of the pancreatic duct, and also ascending cholangiohepatitis. So in this image, the stenosis and then the pancreas, which is in section, where you can observe a severely dilated pancreatic duct, and histologically there was a chronic progressive pancreatitis. And in the same case, you can see this severe dilatation of the bile duct containing abundant sticky bile. Here there was a severe ascending cholangiohepatitis with severe dilatation of the bile duct and accumulation of bile. Classic complication of a stenosis of the duodenum associated with previous ulceration. And as I mentioned before, another complication is a progressive ascending erosive to ulcerative esophagitis. Kind of similar to the lesion you can observe in humans with gastric reflux, in this case extremely severe. The triggering factor of this syndrome are not very well known. Some people speculate a bacterial anterior enteritis, like in the adults, but in foals inducing a more deep, severe lesion with ulcer scarring. Other people believe that some drugs are able, perhaps non-steroidal anti-inflammatory drugs, are able to induce a condition like this, but it's still largely unknown. In some cases, we can observe some attempt to repair in the stomach of the foal following gastric erosion and ulceration. In this case, possible to observe this cobblestone hyperplasia involving the whole squamous portion of the stomach. And here there is an attempt to repair of gastric ulcers involving the squamous portion, the margoplicatus, but at the same time there is a deep ulcer with perforation on the bottom part here, the darker area. And if you examine the stomach of foals and adult horses, don't forget also to examine the pyloric area. Often the pyloric area has some deep ulcers that can be clinically rather significant, like in this case. So remember to extraflect the pylorus to complete your evaluation of the gastric mucosa. This is a postprandial prominency and dilatation of the intestinal lymphatic vessels, which is absolutely normal. This is an incidental finding, but is not a pathologic finding. Lymphatics are supposed to look like that postprandially in the foal. Occasionally, but less frequently in the foal than in other species like calves or lambs or other animals, it's possible to see partial or complete dysgenesis or agenesis of segments of intestine. In this case, there is a lack of connection between part of the large intestine and the small colon. So a prominent segmental agenesis, of course, not compatible with life. Again, these kind of changes are more common in ruminants, pigs, and rather rare in the equine species. Severe necrotizing enterotic colitis, in this case due to Clostridium. The lesion is very severe. Intestines are very dark, in this case characterized by a rather friable wall. An extreme case. In this case, the differential diagnosis will be between a displacement, so a volvulus involving large part of the intestine, here almost the whole intestine, or progressive rapid colonization of the mucosa by bacilli of the genus Clostridium with severe necrotizing, necrohemorrhagic enterotic colitis. Sometimes displacement can be colonized by bacteria, can be also colonized by Clostridium. So you can see some wall changes histologically suggesting circulation problem, a circulation disorder due to the displacement, but at the same time you can see a bacterial colonization of the mucosa. So sometimes histologically it's a little bit difficult without a good signalment and without detailed postmortem gross examination to understand who came first. And histologically, Clostridia act pretty rapidly. You can see that these villi are very pale. This pallor is due to the necrosis, and the blue halo on the top of the villi are myriads of Clostridium organisms inducing necrosis of the intestinal surface with their powerful toxins. Then foals suffer of displacement, as we mentioned, but much less than adult horses. So sporadically we see small intestinal volvuli, or rather rarely large intestinal volvuli, like the colonic volvulus. And in this case we can observe blood vessels that are very prominent. We can appreciate the clockwise or anti-clockwise torsion of the compromise of the mesentery. The pathogenesis is the usual for displacements. The arterial blood vessel keep providing blood supply to the viscera, and but the displacement induced the complete shutdown of the venous return with progressive accumulation of blood, hyperemia, hemorrhage, and eventually ischemic necrosis. Another example of intestinal volvulus, once we open the abdominal cavity of this foal, and you can observe here the large portion of small intestine involved in this case by the segmental hemorrhagic necrosis once we remove the whole intestine from the abdominal cavity of the foal. Occasionally, we can observe a mild to severe thickening of the mucosa of the ileum with this granular appearance on the surface, and this is a case of Lassonia Intracellularis infection. Lassonia Intracellularis is mainly a pathogen of the porcine species, but occasionally can affect in the same areas of the intestine also other species, and occasionally foals. Histologically, it's possible to observe moderate to severe infiltration on lymphocytes and plasma cells within the intestinal lamina propria, but especially there is a increase in numbers and cellularity of intestinal glands. Sometimes there is also ulceration, and occasionally in the fall mild to moderate hemorrhages. The organisms in the past called symbionts intracellulari, they had some very interesting names, now Lassonia Intracellularis. It's possible to observe this organism, this bacteria, using histochemistry, in this case a Wortingsteri, a silver stain that put in evidence this banana-shaped organism within the cytoplasm of the cells of the intestinal glands. Or it's also possible to use more specific techniques like indirect immunohistochemistry to detect the specific antigen of this bacteria. Again, proliferative ileitis due to Lassonia Intracellularis. Occasionally, we still observe in the Ovarofol the equivalent of human colonic aganglionosis of also called Hirschsprung disease. In these foals, which are severely hypopigmented, as you can see here in this image, almost albino, but still they present some pigmentation around the eye or around the oral, around the lips and on the muzzle. In this animal, there is a defect of the migration of the precursors of the melanocytes and the precursors of ganglion cells from the neural crest to the skin and also to the colon. So these animals are severely hypopigmented, and the colon present very few ganglion cells. The result is, as I said, this prominent hypopigmentation, but especially lack of motility of the large intestine due to the almost absence of intestinal ganglia. So there is a progressive accumulation of meconium in the lower tract of the intestine, and then this animal dies after a few days with severe colic syndromes, also not only due to the mechanical impaction of the meconium that doesn't progress, also due to the proliferation of bacteria. In fact, histologically, it's possible to see sometimes some moderate to severe bacterial enterotic colitis due to also Clostridium and other bacteria. So, aganglionosis in the Ovarofol, the equivalent of the aganglionosis of humans, the Hirschsprung disease. Unfortunately, Salmonella can often affect our animals, in particularly large animals, and in particularly horses. Salmonella is can induce no lesion, so it can just colonize the intestine and lymph nodes of small, of young and adult animals without causing any problem, but being shed progressively in the environment, and then can produce a whole series of lesions that varies to mild to extremely severe until, and with the most extreme able to induce, to affect several organs and leads to death the animals that is affected. So Salmonella can cause catarrhal enteritis, like in this case, but also can induce more severe lesions like fibrinous enterotic colitis, necrotizing lesions, lymphadenitis, which can be also necrotizing, occasionally hemorrhagic. Can also colonize the liver, inducing necrotizing hepatitis. It can induce pneumonia, polyarthritis, but also meningitis, osteomyelitis, and so it's a bacterium that can cause, can colonize pretty much any organ in the equine body and also other species, and can present with a very variable number of lesions with various features. So catarrhal enteritis due to Salmonella. Once the intestinal tract is open, it's possible to see this combination of serum and mucus, which produce the catarrhal enteritis. Histologically, it's possible to observe a large number of inflammatory cells, lymphocytes, plasma cells, some macrophages, inducing thickening of the mucosa, and then edema, and occasionally bacteria. Sometimes the intestine is severely thickened. In this example of serosal view of catarrhal and fibrinous enteritis, the etiologic agent again is Salmonella. Also, the large intestine can be affected. This is the aspect of the mucosa with catarrhal and fibrinous colitis. At this stage, you can start seeing some histologically some ulceration as well. And sometimes lesions multifocal, again necrotizing, sometimes hemorrhagic enterotic colitis. In these cases, when you got these multifocal reddish areas, often you can observe small abscesses with Salmonella organisms in the center, surrounded by neutrophils and macrophages within the lamina propria. We believe that since there is no ulceration on the surface of these areas with abscess and hemorrhage, we speculate that the macrophages are able to veiculate in their cytoplasm Salmonella, and eventually there is an abscess formation in the lamina propria. And in certain cases, possible to observe more diffuse changes, like this chronic diphtheritic enterocolitis, enterocolitis in this case, due to Salmonella. And sometimes the mucosa is so severely affected, which is covered by a thick layer of dense, brownish, extremely malodorous, septic tank-like odor exudate. And occasionally some falls with lymphoid hyperplasia. At New Bolton Center, we were able to, our microbiologists were able to isolate Salmonella. But there are several animals, especially young animals, that present lymphoid hyperplasia without being resulting positive for Salmonella. And this is the mucosal view of the intestinal lymphoid hyperplasia, in this case with very prominent lymphoid follicles. It's normal to observe in a Foal more prominent lymphoid tissue, especially more prominent lymphoid follicles in the gut, and to see more prominent lymph nodes, but this is an extreme example of lymphoid hyperplasia. This is not considered normal. And possible causes are antigenic stimulation due to perhaps chronic infection. And so anytime you see lymphoid hyperplasia, suspect Salmonella and do your culture. Also consider that Salmonella is not always an easy agent to isolate. It needs special media. And also the patient you are evaluating on your table perhaps went through several antimicrobial treatments, so perhaps the growth in microbiological plates is inhibited because of this previous antimicrobial treatment in vivo. In this case, a necrotizing colitis with perforation. You can see large part of the colon are involved, with eventually a full thickness necrosis and perforation. And this is a close-up on the full thickness necrosis and perforation with then secondary septic peritonitis in these falls. When you see a lesion like that, consider at least 3 possible etiologies. A colitis associated with non-steroidal anti-inflammatory drugs treatment in a dehydrated animal, or Salmonella, or Clostridiosis. But Salmonella first. The lesion in other species, including humans, unfortunately can be very similar. And then other conditions can mimic salmonellosis, presentation of salmonellosis. In this case, there is systemic vascular necrosis and hemorrhages. In this case, associated with purpura hemorrhagica in a Foal, caused by Streptococcus equi antigen-antibody complexes deposition in blood vessels, with eventually the developing of this purpura with severe multifocal hemorrhages in various parts of the patient body. In these falls, there was severe hemorrhages in the lung, in the large intestine, small intestine. drainage of blood, as you can see here in the colonic lymph nodes. And histologically, there was a severe necrotizing vasculitis. Lesions actually very similar to also equine viral arteritis. Some highly pathogenic strain of EVA, like the Bucyrus strain, can be associated with lesions very similar to purpura hemorrhagica. Sometimes even indistinguishable at the microscope, and you'll have to use immunohistochemical techniques or conventional virus isolation and or PCR to detect the etiologic agent, EVA. More lesions associated with purpura hemorrhagica. You can see here multifocal to coalescing hemorrhages in the various portions of the stomach, especially here on the left in the squamous portion of the stomach. Again, purpura hemorrhagica. And sometimes the lesions in the intestine, the vascular lesions are so severe, you can have accumulation of blood within the intestinal lumen with formation of a blood cast, formation of a clot. And purpura needs to be differentiated, as I mentioned, with equine viral arteritis, which is sporadic, but occasionally it occurs with a similar presentation. But also in the newborn foal, especially when foals are infected in utero and they're born and they present, they are affected by equine herpes virus 1 infection in the various systems. In some of these foals, in addition to the pulmonary necrotizing bronchiolitis and sometimes necrotizing hepatitis and necrosis in various organs, the virus can also colonize the small and large intestine, inducing enteric necrosis. Generally, there is a dilatation of the small intestine with this reddish appearance. And once the small intestine is open, it's possible to see some erosion of the mucosa and deposition of fibrin, like in this case, severe hyperemia and also some hemorrhage. And histologically in these animals, it's possible to observe a mild to sometimes to severe necrosis of the intestinal crypts, and with immunohistochemistry, like in this case, with indirect immunohistochemistry, with a monoclonal antibody recognizing structural glycoprotein of equine herpes virus 1, it's possible to detect viral antigen in large quantity within the intestinal crypts. In some of these animals, there can be also secondary bacterial infections, for instance, Clostridium, Salmonella, or other common bacteria which are not necessarily highly pathogenic in normal condition, but with severe leukopenia associated with the viral disease and with a severe necrosis and ulceration can act as secondary pathogen in these foals. Also imagine the amount of virus that can be shed by these animals in a neonatal intensive care unit or in an equine hospital. The diagnostic difficulty to detect equine herpes virus in a foal is there. The clinical presentation is of a foal with a bacterial infection, a septicemia, and viremia to EHV1 is similar. So the catch is to try to diagnose the disease very fast to avoid a nosocomial spread of the disease. And again, since septicemias and neonatal viral infection can be clinically very similar, it's very challenging to make a diagnosis very fast. PCR on the Buffy code and on secretion excretion could be a way to go. And post-mortem, of course, histologic examination of all the tissues and evaluation of the lesions and indirect immunohistochemistry. In some septic falls, it's possible to observe DIC, and DIC can present like the previous condition, can present like hemorrhagic salmonellosis, herpes virus 1 infection, purpura with enteric acute hemorrhages. So disseminated intravascular coagulation can be also post-mortem diagnostic challenge. And once the small intestine is open, it's possible to observe, like in the previous cases, a large amount of blood. In this case, unclotted, and in this case, with a considerable amount of mucus. So the challenge will be the histologic differentiation between a viral infection, a purpura hemorrhagica, which is an antigen-antibody complex vasculitis, and disseminated intravascular coagulation. And we can add also perhaps anticoagulant toxicity, but which is very rare in the horse. This is a relatively new condition for veterinary medicine. In human neonatology, there is a condition called neonate necrotizing enterocolitis, or ischemic enteropathy, which now we start also observing in some foals. These animals don't have any purpura, don't have any salmonellosis. This is a ischemic condition of the foal intestine associated with this gross presentation, which is pretty segmental, so it can be also confused for a displacement of the small intestine. But histologically, it's possible to observe necrosis of tipo de villi, generally not associated with bacteria. These animals tend to be, we tend not to isolate pathogenic bacteria from the intestine. And again, the lesions are characterized by hemorrhage, necrosis of tipo de villi, and the intestinal content generally has got this appearance, mucus and blood. Again, you can see that the gross differentiation between all the conditions we just mentioned, equine herpes virus 1, equine viral arteritis, purpura hemorrhagica, DIC, and now this neonate necrotizing enterocolitis can be pretty difficult. And this is the intestinal lumen with the intestine, with the mucosal lining, the distal portion of the intestine with no lesion in the mucosa and lamina propria, but with accumulation of blood within the lumen. So the lesion tend to be more proximal, and then accumulation of blood is within the proximal tract of the intestine and also within the distal, where there are no appreciable histologic lesions. Ulcerative colitis and caseous lymphadenitis due to Rhodococcus equi. You can see large part of the intestine are thickened, and there are multiple nodules which are caused by the colonization of the coccus of the intestine with the production of these large areas of caseous necrosis. And in cross section, the lymph nodes look like appears with a caseous exudate, like in the lymph node I show you at the beginning of this presentation. And once the intestine is open, often it's possible to see some brownish exudate, but especially a multifocal ulceration. And histologically it will be possible to see a pyogranulomatous inflammation, areas of caseous necrosis, and sometimes some intracellular, intrahistiocytic, but sometimes also extracellular coccobacilli, Rhodococcus equi. We still see various degrees of Parascaris equorum infestation in foals, sometimes associated with a combined accumulation of fibrous digesta and rupture in the Foal small intestine. Intestinal perforation. I confess that someone we see intestinal perforation in the young and adult horses that we observe, but it's sometimes very difficult to find a cause. Histologically, sometimes we are able to see some the results of a progressive ulceration, sometimes with thrombosis, so sometimes we can blame perhaps a septic embolus, like in this case. Sometimes we find some defects of the mucosa lamina propria that can justify this intestinal rupture perforation, but in this case we didn't find any possible etiology, no foreign body, no previous defect. So sometimes the diagnosis is a little bit challenging. But intestinal perforation are sporadically seen not only in adult horses but also in foals. But definitely in the foal, the gastric perforation is more common, much more common than intestinal perforation. In the adult horse, the gastric rupture is more common than the intestinal perforation. Sometimes to detect the perforation in not only the foals but also in adult horses can be pretty challenging, because with the secondary septic peritonitis it's pretty difficult to find the perforation spot in all that mess. So what I suggest is to my colleagues to follow the fibrin accumulation. You see severe septic peritonitis, septic fibrous peritonitis in a foal or an adult, you will be able to see some areas where there is a more prominent fibrin accumulation, and it's there where you want to basically emphasize your search for the detection of the lesion. Tapeworms. We all know that adult horses can be heavily infected with tapeworms, Anoplocephala perfoliata, but also 1, 2, 3, 4 to 5 month old foal, especially if they didn't get the right anti-helminthic treatment, which is rather specific for tapeworms, they can have quite a large number of tapeworms. In this case, in this foal, it's possible to observe a prominent accumulation of adult tapeworms, Anoplocephala perfoliata, and you can see that the ileocecal valve is severely affected, severely thickened, edematous, and eroded and ulcerated. And this picture that we don't see very often is a rather prominent infestation of the colon, of the small colon, with especially the terminal portion of the small colon, due to pinworms, Oxyuris equi. In a non-recent past now, this infestation was much more common, but then with the most modern anti-helminthics, this parasite became very uncommon. Histologic image of the small intestine colonized by the Coccidia Eimeria leucarti that can be seen sporadically in both foals and adults. Various stages of the Coccidia here can be observed within the lamina propria, within the stroma of the villi. Liver, affected by multifocal necrosis due to equine virus 1 infection. This is a pathognomonic lesion of fetuses and sometimes foals, stillborn foals, affected with equine virus 1. And the gross appearance of the necrosis is very characteristic. Lesions are grayish. They're not yellowish, they're not whitish, they're grayish. and to each areas of necrosis generally correspond a prominent colonization with the virus, a pathognomonic gross lesion. And in this immunohistochemical evaluation of liver tissue, it's possible to see how the virus works. The virus progressively colonizes the endothelium, in this case of a hepatic venule, and then the virus progressively invades the endothelium, the sinusoids, and then progressively invades the hepatocytes. So it is the pathogenetical mechanism of the of the necrosis in the hepatic parenchyma caused by equine herpes virus 1 detected with immunohistochemistry. Liver, multifocal necrosis due to equine herpes virus 1. The majority of herpes viruses in mammals generally tend to induce multifocal necrosis in the parenchymal organs. Well, in the newborn foal, which is often infected with is born infected with the virus, and in the equine fetus, is possible very frequently histologically, sometimes even grossly, like in this case, appreciate this multifocal grayish lesion corresponding histologically to areas of necrosis. The lesions need to be grayish. They're not white, they're not yellowish. When lesions are yellowish, are generally due to a bacterial infection. When they're white, they're generally due to multifocal scarrings. They need to be grayish, and histologically then will be possible to appreciate the highly suggestive or pathognomonic lesions of necrosis associated with the formation of intranuclear inclusions. Immunohistochemically, it's possible to understand more about the pathogenesis of this condition. The virus, once is able to pass the placenta, colonizes the endothelium of the fetus or the newborn foal, transported then by leukocytes, and then from the endothelium, it progresses, in this case of a hepatic venule, it colonizes the endothelium of sinusoids, and then progressively invades the hepatocytes, where it induces a cytopathic effect. Even in this case, with a contact stain with hematoxin, it's possible to observe the formation of some inclusion bodies here. That is pretty much the pathogenesis of the necrosis of the equine herpes virus 1 infection in the liver. Other agents are able to induce liver necrosis. In this case, lesions are kind of whitish to yellowish, and is a multifocal necrosis due to a bacterial infection. In this case was Actinobacillus E. coli, but also other agents can induce the same lesion, like Salmonella, E. coli, and others. And histologically, in this case, in this liver affected by Actinobacillus E. coli, was possible to observe the formation of small to large areas of necrosis, sometimes micro abscesses, like in this case, with a center of bacterial colonization, Coccobacilli in this case. Sporadically, it's possible to observe foals that die of severe hepatic necrosis due to Clostridium piliforme, and this condition called teaser disease. Often the mare carry the bacteria within the intestinal tract, and for a long time rodents have been blamed also to be carrier of the disease. This is a condition that is seen more in certain countries respect others. And grossly, the liver is often quite enlarged with round edges. On the cut surface, possible to observe areas of multifocal whitish pale discoloration corresponding to multifocal to coalescing areas of necrosis. Then histologically, it's possible to observe mild to severe ample area of necrosis. And then sometimes already with hematoxylin eosin is possible to observe some bacilli, but often a silver stain is needed. A worting study, for instance, or a stainer are needed to identify the bacteria, which they form some rather highly suggestive gatherings, like in this case, mimicking some Oriental alphabet letters. 2 organisms here, and then a bunch of bacilli gathering here. The liver of foals can be occasionally, I would say rarely, affected by neoplasm, primary neoplasm, and a well-described neoplasm of the liver, primary liver tumor in the foal is the hepatoblastoma. Hepatoblastoma can also metastasize to other organs, can even invade the placenta in the equine fetus. Histologically, will be possible to see often a dual population of cells mimicking bile duct formation and cells mimicking hepatocytes. The counterpart in the tumor is malignant in foals, and the counterpart in humans is also malignant, unfortunately. Fibronoceptic peritonitis, in this case associated with intestinal perforation. We already discussed in intestinal perforation and the difficulties to make a diagnosis when we discussed the small intestine. And there is also another possibility that is no perforation in this case, and in septic foals, bacteria can grow within the peritoneal cavity, inducing a septic peritonitis. This is sporadically observed, especially with Actinobacillus E. coli, but also Escherichia coli. And it is the it is the abdominal fluid that can be collected in these cases of septic peritonitis. Respiratory system. A in vivo image of pharynx collapse in a foal. Pharyngeal laryngeal condition can be observed in vivo in foals, and like in this case. And sometimes we need to appreciate better the lesion post-mortem. We need also the help of our clinician with a good signalment and some in vivo imaging correlation. Rarely, cysts, probably due to epithelial remnants, thyroglossal ducts, something like that, can be observed close to the larynx in foals. In this case, the formation of this large cyst induces a partial displacement of the larynx itself. Necrotizing bronchiolitis and edema due to equine herpes virus 1. The clear areas are areas that are partially aerated. The dark areas are areas in which there is atelectasis and also necrotizing bronchiolitis. In addition, the fact that the increasing volume of the lung due to the edema and hyperinflation is pretty clear by the rib impression you can see on the surface. This can be a lesion, a gross presentation of a lung highly suggestive for equine herpes virus 1 perinatal infection, occasionally also equine herpes virus 4. But the gross diagnosis is not sufficient to blame equine herpes virus 1. In fact, other condition, other agent can induce the same. The same gross lesion could be associated with equine arteritis virus infection, could be associated with, this could be the lung of a septic fall occasionally. Also, animals that die of endotoxic shock can be a similar presentation. So, histologic evaluation and often the use of other ancillary procedures like indirect immunohistochemistry for detection of the right etiologic agents are necessary. And this is a good example of correlation between histology and immunohistochemistry. On the left, hematoxyleucine staining of the lung tissue of the previous fall showing necrotizing bronchiolitis. And then if you go at higher magnification, you can always detect the pathognomonic intranuclear inclusion due to this virus. And on the right, the necrotizing bronchiolitis with on the top the immunohistochemical detection of the equine herpes virus 1 antigen. You can see how much virus is contained in this lung section and how easy it is to make a diagnosis using direct immunohistochemistry in this kind of viral infection. Target cells, as you can see, are the epithelial lining of the bronchioles, many sloughed intraluminal necrotic epithelial cells, and also macrophages and endothelial cells. Equine herpes virus 1 is a polytropic virus which likes to colonize white cells like lymphocytes, macrophages, dendritic cells, epithelium, and endothelium. The vector of the virus in the bloodstream is the leukocytes. Then the leukocytes can transport the virus to endothelial cells, which also replicate. And then from the endothelium, the virus can reach all the epithelia, especially the respiratory, hepatic, adrenal, and intestinal epithelium. Organs where the virus can be almost always detected in the fetus and in the fall are lung, liver, lymphoid tissue, and adrenal glands. In particular, for the lymphoid tissues, I suggest always to collect the thymus, spleen, and possibly also a lymph node. But if you will perform your histologic examination and immunohistochemistry on lung, thymus, liver, and adrenal glands, you will rarely or never miss equine herpes virus 1 or 4 abortion or stillbirth. This lung is diffusely gelatinous and yellowish. This is a combination of edema and meconium inhalation. Falls that are hypoxic, fetuses and falls that are hypoxic in utero start often defecating in utero. This phenomenon is called fetal diarrhea. When they defecate within the amniotic cavity, then they can inhale amniotic fluid containing the meconium. So for this reason, they can develop a secondary non-septic pneumonia associated with meconium. Histologically, it will be possible to see just meconium accumulations, a little bit histiocytic infiltration, but if the meconium inhalation is prominent and the animals survives, it can develop histiocytic granulomatous pneumonia toward the meconium, which is irritant for the airways. Meconium inhalation is also sometimes associated with equine herpes virus 1 abortion and stillbirth. So some consider the presence of meconium in the lung highly suggestive of EAG1 infection. This is not necessarily true, but definitely several equine herpes virus 1 abortions and stillbirth are associated with fetal distress and meconium inhalation. More edema here involving the lung, the Gleason capsule of the liver, and the stomach. Again, the gross differential diagnosis, it will include all the possible etiologies that I just mentioned a few slides ago. In this case, going to be, it was equine arterivirus infection, equine viral arteritis. Like for equine herpes virus 1, foal can be born already infected in utero, and in this case, foals almost always, especially if they didn't receive the colostrum, they are not particularly protected, they can develop acute to subacute severe bronchointerstitial pneumonia with severe respiratory distress and death. If the virus is able to colonize, if the animal is able to survive a little bit longer, the virus then from the lung colonizes blood vessels, the blood vessels several other organs with systemic vasculitis and eventually also tubular necrosis of the kidneys. Cross section of the previous lung, this is the lung which I just showed you, and this is the cross section. The clear area are partially aerated areas, and the darker area, reddish, are areas with atelectasis and bronchointerstitial pneumonia. Histologically, equine artery virus induced bronchointerstitial pneumonia in the newborn foal. Equine herpes virus 1 mainly causes necrotizing bronchiolitis with inclusion bodies. So histologically, the two conditions are easy to be diagnosed. In the previous form of in the early phases of infection of the lung infected with equine varicositis in the foal, it's not necessarily possible to see the vasculitis. So if you see bronchointerstitial pneumonia, you don't see vasculitis, don't think that it's not going to be EVA. It could be EVA, because generally the vasculitis develops 3 or 4 days after the infection. And this is the histologic appearance of a foal with infected with equine enterovirus. You can see that the alveoli are barely recognizable. There is a prominent pneumocytic hypertrophy and hyperplasia, macrophages within the alveoli, some slough epithelial cells, and also the formation in this case of hyaline membranes. And with immunohistochemistry, it will be possible to detect the sporadic viral antigen, the scant viral antigen present in epithelial cells or sometimes endothelial cells and macrophages. In this case, it's possible to see 2 pneumocytes which are severely hypertrophied, containing within their cytoplasm the equine arterivirus antigen in direct immunohistochemistry. In the background, it's possible to observe the bronchointerstitial pneumonia. And if the animal is able to survive at least for a few days, it's possible also to observe pulmonary vasculitis, arteritis, and phlebitis. And with immunohistochemistry, it will be possible to see the virus colonizing the cytoplasm of endothelial cells, myocytes, and sometimes pericytes. At the same time, with this technique, it's possible to detect in the background edema of the blood vessel and the lymphocytic infiltration. Sometimes it will be also possible to detect fibrinoid necrosis of the tunica media, but not in all cases. Remember that histologically sometimes it's difficult to recognize, at least talking about the blood vessel lesion, purpura hemorrhagic histology changes from equine varicositis, not necessarily only in the lung, but also in the skin, especially in the skin. And talking about purpura hemorrhagica, this is a case of severe bilateral acute hemorrhage in this foal associated with vascular necrosis due to purpura hemorrhagica, which I remind you again is caused by deposition of Streptococcus equi antigen-antibody complexes within the blood vessels, leading to a leukocytoclastic vasculitis. And rarely, especially now with vaccination and with more advanced hygiene techniques in farms and hospitals, sporadically in the past was possible to observe bronchointerstitial pneumonia and secondary bacterial bronchopneumonia due to equine orthomyxovirus. In this interesting picture taken from the website of University of Georgia. The classic viral lesions are like in any species, this multifocal reddish discoloration, which in other species where there is a more lobular organization of the lung, appear like a lobular pattern, and at the same time there are some cranioventral, there is some cranioventral involvement, some cranioventral bronchopneumonia due to the secondary bacterial complications. A lung affected by embolic bacterial pneumonia, the lesions are multifocal, sometimes multifocal to coalescing, indicating clearly embolic distribution. Bacteria able to cause this are many, especially Salmonella, Escherichia coli, Actinobacillus ecoli, and Streptococcus species, especially Streptococcus equi and Streptococcus equi zooepidemicus. Sometimes the lesions are less suppurative and more necrohemorrhagic, like in this case. Agents can be present as in a situation of septicemia, or can also embolize to the lung and to other organs from a skin lesion or a foot lesion, or even from a navel lesion. Another example of embolic bacterial pneumonia. Sometimes the lung is almost completely affected, like in this cross section. There are no visible ghostly evident area of aeration here. The whole parenchyma is affected in a sort of diffuse, almost complete hepatization. It is a diffuse pneumonia in a septic miniature foal. And histologically, it's possible to observe areas of necrosis, consolidation, and suppurative bronchopneumonia with accumulation of exudate comprised of mainly neutrophils, often necrotic neutrophils between airways and bacterial colonies. In this case, unusual case of neonatal bronchopneumonia due to Listeria monocytogenes, which sporadically is able to induce placentitis in the horse. I would say sporadically, very rarely, and also neonatal infection. But generally, other bacteria cause this lesion. E. coli, Actinobacillus, Salmonella, others. Listeria is pretty much a remote etiology, but keep it in consideration. Cross-section of lung of this 36-hour fall with this multifocal patchy reddish discoloration in some more clear areas. And you need the microscope in these cases to make your diagnosis. This could be viral infection, could be bacterial infection, could be neonatal incomplete lung expansion with atelectasis. This happened to be histologically a mild, early, acute bronchopneumonia in addition with atelectasis. Another lung which is expanded, and expansion is represented here by the rib impression. In this case, the whole lung was firm, heavy, very heavy. This is an example of diffuse pyogranulomatous pneumonia, bronchopneumonia, pyogranulomatous bronchopneumonia due to Rhodococcus equine infection. The lung has been removed from the thoracic cavity. You can see still here the rib impressions, the diffuse pattern, and also how enlarged can be the bronchial lymph nodes. So in this case, not only pyogranulomatous bronchopneumonia, but also pyogranulomatous lymphadenitis, Rhodococcus equi. A close-up on the lymph node, which is severely enlarged, 7-8 times the normal size, even more. Again, pyogranulomatous bronchial lymphadenitis due to Rhodococcus equi, a lesion we see very frequently. And sometimes, as evident in this beautiful picture of my colleague, Dr. Perry Habecker, the diffuse pattern of pyogranulomatous inflammation which induce this kind of whitish, clearly solid change in the parenchyma, can be associated with areas of caseous necrosis, which is characteristic of this agent and this disease. These areas of necrosis are also called abscesses, and their accumulation of caseous exudate almost with no capsule, often with no capsule, with transition between affected and non-affected parenchyma in these large areas of necrosis. And sometimes the agent is able to form these more suppurative lesions with formation of cavitations. This is a little bit a reminder of human TB, tuberculosis. I mean, Rhodococcus equi has got some biochemical features very similar to Mycobacterium species. So, and this is a lesion that is kind of similar to Mycobacterium in humans and occasionally in cattle. Histologically, here is possible to see a transition between the areas which are more pyogranulomatous, with effacement of the parenchyma with accumulation of histiocytes and some lymphocytes, plasma cells, some neutrophils within the parenchyma, which with areas of where the lesion becomes more necrotic and suppurative. So on the right side here, a more histiocytic change. Here on the left, neutrophilic, pyogranulomatous bronchopneumonia. And in this image of Professor John King from Cornell University, it's possible to see the whole parenchyma, again, with the changes we previously described, associated with multifocal areas of necrosis. And these happen to be histologically a Rhodococcus equi infection, complicated with pneumocystis. This is how Rhodococcus equi look in using a gram stain, gram-positive coccobacilli, which are mainly intracellular within histiocytes, as you can see in this bacterial gathering here. And in the few cases where it's possible also to detect pneumocystis, in my experience, a rare complication of Rhodococcus equi pneumonia, in this case with silver stain, will be possible to see these spherules, which are the organisms. Pneumocystis carini. Cardiovascular system. Heart defects, sporadic, but regularly seen on our facility at New Bolton Center. Also because we have great cardiologists at New Bolton. For instance, Dr. Gene received many cases, and we received some of these terminal cases. And pretty much falls can be affected by all the cardiac defects that affect other species. In this case, probably one of the most common cardiac congenital defects in our animals, the interventricular septal defect. In this case, in a miniature breeds. Miniature breeds seems perhaps to be a little bit more affected than others regarding these congenital cardiac defects. And these are fall with persistent truncus arteriosus and an unusual complication, in this case, the rupture of the base of the aorta, which is rare in the fall. Is sporadically seen, I would say not very common, but sporadically seen in adult horses, but rather uncommon in foals. Then occasionally we can see hematocysts. And then, much less frequently than cattle, but where this condition is more common, but in a few cases we can see vegetative fibrinous valvular endocarditis in foals. Apparently, these foals often have some valvular congenital defects where there are some changes in the hemodynamics accumulation of fibrin on the valve and colonization of these areas with bacteria, and then the terminal complication is a vegetated fibrinous valvular endocarditis. Bacteria that can be isolated from these valves in certain cases are Escherichia coli, Actinobacillus E. coli, Streptococcus species, and sometimes others. Rarely we see this complication of septicemia in falls. In this case, a Streptococcus equi infection complicated by fibrinous pericarditis. This is the heart that was covered with these fibrin layers, which has been removed and put aside for your vision. Cardiac defects, congenital and acquired, they produce sometimes systemic passive congestion, and so the liver of some falls can be affected by it, and this is the gross presentation of the expression of systemic passive congestion. Histologically, there will be hyperemia, dilatation of sinusoids, sometimes hepatocellular atrophy, sometimes mild to moderate fibrosis, and this is the gross presentation, the so-called nutmeg liver, systemic passive congestion. Muscular and skeletal systems. In falls living in an area where the feedstuff they receive are poor in vitamin E and selenium, can develop white muscle disease with skeletal muscle necrosis and mineralization. I remember perfectly in this case, I observed this case in Italy. This fall was presented with neurologic syndrome. In reality, the neurologic syndrome was not a neurologic syndrome. This animal had a totally normal, grossly histologically central nervous system, but the musculature was severely affected by multifocal to coalescing necrosis and mineralization. Classic lesion of vitamin E and selenium deficiency. It's a disease responsive to vitamin E and selenium administration. Rarely, very rarely, we can observe sarcocystis species in the skeletal muscle in the myocardium of foals and adult horses. Then foals are very lively, very curious, very busy, and they get scared very easily. And unfortunately, this can predispose to mild to extremely severe injuries, like in this case. In this case, this foal got caught in a wire with secondary tendon laceration, metacarpal indentation via wire. You can see here this tendon is completely resected, and even here is the sign of the wire, where the wire acts on the periosteum. There is the indentation, a very, very severe lesion, unfortunately. Then we can observe abnormalities, very rarely I would say, abnormalities of the limb segments involving part of the bones or even segmental bones themselves. And more commonly, we can observe complication of sepsis, colonization bacteria of joints, where there can be a secondary subacute chronic septic arthritis or arthros synovitis. In this case, also with fistula formation. So such a proliferation of bacteria within this joint and such an accumulation exudate, the exudate progressively find a way to induce a lytic effect on the soft tissue and eventually open up on the skin with a fistula formation. In this case, a metacarpal septic physitis here with detachment. So pathologic fracture involving the physis, predisposed by bacterial colonization. Bacteria tend, unfortunately, to colonize the physial areas where there are rather tortuous blood vessels, and they tend then to develop physitis with osteomyelitis and pathologic detachment of the physis. Traumas, as we mentioned, they can affect falls related to their behavior and or related to some object present in some paddocks on some areas where the falls are present. In this case, the trauma was associated with the underlying fractural deformity. Extreme hemorrhage in this case. In these cases, you want to try to identify if this is a trauma or is more expression of a systemic hemorrhagic diathesis, for instance, predisposed by an underlying purpura hemorrhagica. Hock joint, bacterial arthrosynovitis. In case of sepsis, bacteria can colonize the joints with fibrinous bacterial arthrosynovitis, and postmortem, where you can detect more easily the lesions, are the Hock joints. For a reason we cannot explain, the Hock joints can tend to be more affected. At least the exudate tend to be more abundant, so you can make your cross diagnosis, opening up the Hock joints in a easier way. And in this case, another physitis with osteomyelitis and associated pathologic fracture, as we mentioned previously. Parturition trauma can be associated to rib fractures. Not necessarily these rib fractures are fatal, as we'll see in the next slides, but the torsion of the newborn during the extraction within the uterine cavity and then within the vaginal cavity can predispose to this kind of rib fracture. You can observe 1, 2, 3, even for up to 7 or 9 fractured ribs. In this case, the fracture was fatal because it was complete, and the sharp edges of the fractured rib cut the intercostal blood vessel, inducing a fatal hemothorax. And sometimes, unfortunately, the sharp edges of these ribs can also puncture the heart with fatal intrapericardial hemorrhages. But this is not the usual event. Generally, these animals tend to survive because the fractures are not complete, or anyway, the fractured rib don't injure the blood vessels, or are still contained within the thoracic pleura and connective tissue. As in this case, this foal died for other reasons, and in this case there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 fractured ribs. This animal, if they don't die for other conditions, they can be saved. I mean, in fact, repalpation neonat is a common practice to identify if the animal's got any fractured rib. And it is a foal that died for other reasons. Months after parturition, you can see that the calluses are pretty well formed. More traumas. In this case, there is a vertebral column fracture with dislocation. Lesions between T10 and T12, 14 are unfortunately common. Looks like there are spots where traumas, especially falls in adults running against objects or against wall, or sometimes in the dark against each other, can tend to develop lesions in these thoracic areas. You can see that there is a complete vertebral fracture here with dorsal dislocations in this segment and compression and severing of the spinal cord. Very prominent lesion. A complication of bacterial infections systemically are vertebral abscesses, like in this case. a vertebral body severely affected with collapse and formation of cavitation, a necrotizing suppurative osteomyelitis, chronic, severe. Agents involved in these cases are Rhodococcus equi, Escherichia coli, Streptococcus, Actinobacillus equili, and occasionally others. Always consider Rhodococcus equi. And Salmonella can easily colonize the bone marrow of long bones and generally bone tissue in general, and induce areas of necrotizing osteomyelitis. Lesion here is triangular shape, and you can see this reddish discoloration in the middle, and then this necrotic halo around. This is a septic osteonecrosis associated with Salmonella septicemia in a foal, and osteomyelitis as a complication. So if you got time, and if you got a bandsaw, it's always a good idea to split longitudinally quite a few bones at the end of your necropsy to see if there is any osteomyelitis. If you don't see any other significant lesion, or if you are curious, like we are. Although it is a lesion of young horses, but not necessarily newborn foals, occasionally articular mice, articular tophi can be observed in 2 to 3 to 4 month old foals as an example of osteochondrosis dissecans. General lesions are more prominent between the 3rd to 4th month up to the 7th, 8th month. And facial deviation acquired in utero can be observed in the newborn. These animals are often born suffering a condition called body pregnancy, excuse me, where the foal, the fetus and the foal develop progressively only in the uterine body without expanding within one of the uterine form. So often these animals are born with contracted limbs and with some deviation sometimes of the facial bones, like in this case. And as I show you the congenital hemangiosarcoma of the oral cavity, sometimes we can see congenital hemangiosarcomas of the joints. In this case, there was an intraarticular hemangiosarcoma which progressively eroded and digged a hole within this metatarsal bone. And histologically and immunohistochemically is easy to make a diagnosis. If you got a tissue which is not necrotic, it is often a complication of this tumor. So you can see really abnormal endothelial cells which are easily stained with antigen specific for endothelial cells, like factor VIII and others. Endocrine system, adrenal hemorrhages. Adrenal hemorrhages in animals with septicemia associated with Actinobacillus equili infection are very common. Everybody knows that the kidney can be a target of Actinobacillus equili. Less people know that you always can observe, almost always can observe, in case of renal infection with Actinobacillus equili in foals, you can observe at the same time adrenal hemorrhages, necrosis, and also you can identify the bacteria within the renal cortex. Interestingly, in humans with sepsis, the adrenals got similar hemorrhages, but the hemorrhages tend to be more medullary. In the foal, tend to be cortical. And in the adrenals, you can detect his foci of necrosis with neutrophils surrounding the Actinobacillus equili coccobacillary colonies. Good target organ for the detection of the bacteria, histologically and microbiologically speaking. And adrenals, as we probably previously mentioned, can be affected by equine herpes virus 1 infection. Actually, they are a target organ in the bovine and equine fetus for the detection of lesions, antigen, and isolation with conventional virology technique of equine herpes virus 1 in the foal and bovine herpes virus 1 in the bovine fetus. And in this case, we can observe in the zona glomerulosa some adrenal cortical cells colonized with equine herpes virus 1. Here is the staining indicating the antigen presence. in these large epithelial cells here, in these necrotic cells right here, and these endothelial cells here on the top. Clearly, the morphology indicates we are in the zona glomerulosa of the adrenal cortex. Then, more endocrine, in some areas with not enough iodine, Foals can develop goiter. In this case, there is a prominent bilateral hyperplasia. And occasionally we found some non-significant changes in the thyroid, like this supernumerary thyroid in this Foal, absolutely compatible with life, just a curiosity for the pathologist. Nervous system. Rarely you observe with Foals born with ocular dysplasia, in particular microphthalmia. Histologically, the changes are very complicated, affecting various parts of the eyes, but grossly the detection is easy because clearly the orbits and the eyes themselves are smaller. If this in cattle is due to a viral infection like BVD, in Foals there is no viral etiology described. It is a lesion that sporadically seen in Arab Foals, but not only Arab Foals. It is an example of cerebellar abiotrophy, where the cerebellum is diffusely and symmetrically smaller, underdeveloped. You can see that the vermis is still prominent, but these sulci here are unusually extremely prominent, and the whole size of the cerebellum is smaller than normal. The defect increases with the age of the Foal, so in clinical signs become more prominent. So with the growing Foal, the defect becomes more prominent, and can be minimal, mild, moderate to severe. Skull fractures due to trauma can be observed in our Foals, with also related cerebral injuries. And occasionally in Foals, but generally the most significant expression of this condition is yearling, can be affected by the first phases of vertebral dysplasia with malarticulation, inducing cervical compressive stenotic myelopathy. The condition our clinician call wobbler, but pathologists call it vertebral dysplasia with malarticulation inducing cervical compressive stenotic myelopathy. In this case, very severe static and dynamic compression, and sometimes lesions are not necessarily symmetrical, they can be unilateral, like in this case, depending on where the lesion is. And in this case, the lesion was chronic with hemorrhagic necrosis and fibrosis. Arboviruses can affect our Foals. Not necessarily a lot of West Nile virus, which generally affect older horses, but hystericoencephalitis can be clearly observed, affecting the central nervous system and to a lesser extent the parenchymal organs of Foals. And grossly, this disease can present with multifocal hemorrhages. These are brainstem affected by hemorrhages. This is a case of West Nile virus infection. And in these animals, it's possible to, with the use of immunohistochemistry, to observe large quantities of viral antigen within the neuronal bodies and fibers, and also glial cells. Also histologically, there will be a moderate to severe encephalitis associated with glial nodules, like in West Nile virus, but also in hystericoencephalitis associated with neutrophilic infiltration. And the virus can also mildly infect the parenchyma of other organs, like the heart, where it can induce a direct cytopathic effect on the cardiocyte here, testify with indirect immunohistochemistry, and also can colonize the smooth muscle of the wall of the intestine, the stomach, and also the renal interstitium. Petechia can be observed in the Foal brain associated with septicemias and especially Salmonella actinobacillus. And suppurative meningitis with hyperemia can be seen also with bacterial infection like E. coli, Salmonella actinobacillus E. coli, edema and accumulation of pus within the sulci. And occasionally we see brain abscesses and meningitis associated with Streptococcus equi. A rare event, so this condition is rare, but can be, like in other species, brain abscesses can be observed in both young and adult animals. And some foals can be affected by hydrocephalus, various degrees, mild to moderate to severe to extreme, very severe in this case actually. Urinary system. A well-known but rare congenital anomaly is the horseshoe kidney, where the kidneys are not separated but are united at one of the poles, forming this horseshoe shape. Other congenital anomalies, but are rare, can be unilateral agenesis, hypoplasias, dysplasias, as we'll see soon. Like in this case, the kidney on the left has been split and been cut, and open up, and the same thing has been done for the kidney on the right, but one part has been removed for histology. So you can clearly see that this is the right kidney because there is still a sort of vague heart shape of the kidney, and this is the left kidney, but clearly these kidneys are misshapen and small. So these are bilateral hypoplasia, dysplasia, and in foals this has been associated to the treatment of this condition being sometimes associated to foals that's been from mares that's been treated with for EPM, equine protozoal myelitis. So some antimicrobial treatments against the Sarcocystis neurona are predisposed to this condition in foals. In this case, renal tubular necrosis due to equine arteritis virus, which is expressed grossly with these areas of reddish, blackish discoloration. And then histologically will be possible to observe necrosis of the tubules, and with immunohistochemistry, in association of the identification of the tubular necrosis and the interstitial lymphocytic infiltration, will be possible to see epithelial tubular cells and casts colonized with equine arteritis antigen. In this case, the cortex is affected by these reddish and whitish areas of discoloration. The reddish areas of discoloration are corresponding to areas of hemorrhagic necrosis, and this is a Schwarzman reaction with renal infarcts. And in this case, multiple areas of whitish, yellowish discoloration, triangular shape, clearly a vascular related injury, and this is the morphologic expression of renal septic infarcts. This kidney is diffusely pale, and this is an example of subacute to chronic tubular necrosis and fibrosis associated with aminoglycoside toxicity. Multiple microabscesses involving the cortex of this Foal kidney. This is a suppurative cortical nephritis, and the lesion is pathognomonic for Actinobacillus E. coli infection. A close-up of the same lesion where the microabscesses are particularly evident. This is a very severe lesion. Sometimes grossly the microabscesses are not visible grossly, but only histologically. The same kidney in cross-section, where it's possible to see the colonization of the infection and the formation of microabscesses electively to the renal cortex. And histologically, it's possible to observe bacterial colonies invading the glomeruli of the capillaries of the glomeruli, and followed by progressive neutrophilic infiltration with formation of microabscesses. In this case, actually quite large microabscesses with a severe multifocal neutrophilic nephritis. In disseminated intravascular coagulations in sepsis, it's possible to observe thrombosis histologically of glomerular capillaries, like here in this histochemical, particularly evident this histochemical stain for fibrin. And umbilical infection in Foals can be common in certain areas, and this is an example of septic omphalitis and ascendic urachritis with cystitis. Again, the agents can be Actinobacillus E. coli, and Streptococcus. Genital system. In Foals, more often in older young horses, but occasionally in Foals, equine herpes virus 3 infection inducing ulcerative baronopostitis and scrotal dermatitis can be observed. This is a pathognomonic lesion indicating benign coital exanthema, which is a equine herpes virus 3 infection. Generally, these lesions disappear within 1 or 2 weeks. Skin. Laminitis that can be acute. Laminitis is a process where for ischemia, or for some perhaps due to hyperperfusion and activation metalloproteinases, there is a necrosis of the keratogenic laminae, leading to the detachment of them, and then severe pain for the patient affected, and progressive rotation and sinking of the terphalanx. This condition can be also in Foals chronic, like in this case, with severe thickening of the keratogenic laminae and proliferation, due to proliferation of the keratogenic tissue itself. So this is mainly an epithelial proliferation supported by a mild amount of connective tissue. Then, in case of sudden hypoxia in Foals, in fetuses, in newborn Foals, Foals can be born with fetal diarrhea, with So with meconium staining on the skin. In this case, this animal was also hypermature because the vibrissae are pretty long. Then the mucosa in some hypopigmented areas of the skin can be evaluated for the presence of yellow discoloration, like in this case, icterus. And this is a case of anasarca associated with Salmonella septicemia, where the vulvar skin and other lower area, other more distal area of the limbs and the ventral part of the body were affected. Another example of the same case, in this cross-section of muscle and skin is possible to see the severe edema affecting the subcutis. There was also fluid within body cavities like pericardium, pericardial cavity, thoracic cavity, and abdominal cavity. And then in case of sepsis, it's possible to observe severe necrosis, even gangrene of the distal limbs, like in this case. Again, as I mentioned, it's important to also not to evaluate only the subcutis, but also to split the limbs with a band, so to evaluate the presence of necrotizing osteomyelitis. And subcutaneous hemorrhages can be observed in the in case of purpura hemorrhagica, like in this case. This subcutis of hock area and the distal portion of the same limb affected by severe acute hemorrhage in case of purpura hemorrhagica. The mucocutaneous junction can be also affected in the same way, with this prominent red discoloration due to multifocal acute hemorrhages. And this is the same condition, in this case with edema of the limbs. It's happened to be a case of purpura hemorrhagica, but the differential diagnosis include equine valvular arteritis, hypoproteinemia, and other possible skin conditions. Exudative hyperplastic epidermitis, dermatophilosis or streptotrichosis, Dermatophilus congolensis, classic wet, sticky appearance of the skin. And exudative hyperplastic epidermitis, again, streptotrichosis, Dermatophilus congolensis, another type of presentation. And histology will be possible in some cases to see the epidermitis, which characterizes this condition, associated with exudate and the classic linear colonies that this bacteria are able to form on the epidermis. Then occasionally we can see tumor of the skin infolds, but mainly benign, like papilloma associated with papillomavirus. Sometimes these tumors are congenital. And then, in some cases, periocular dermatitis associated with trichophyton or microsporum, these two mycotic infections. And in some areas where these parasites are present in large numbers, where the flies, the adults are present in large numbers, egg depositions due to the fly Gasterophilus species. This is a classic deposition of eggs on the hair, and your differential diagnosis will be with a lice infestation, but the eggs of Gasterophilus are pretty classic in shape and location. And then vascular hamartomatas, which are congenital skin tumors that can be observed in some cases. I already told you about congenital Emangio Sarcomas. These are benign growth, vascular growth, hamartomas. And thank you very much for your attention. This concludes